Hey, what's up guys? It's That Farm Kid and I'm back today after what I know has been a very long hiatus. I know that I had said in my original videos I was hoping to keep you guys in the know with my first year of pharmacy school, the adjustment and things like that. But unfortunately I had to put this project on the back burner and devote 100% of my time to a very rigorous curriculum, which I did survive, but I'm gonna go ahead and make a different video over like just a life update and how that first year of pharmacy school went. But today I want to talk to you guys about a concept that I feel could maybe warrant some clarification. If not, then maybe this can just be an educational resource for you all. But I feel that we need to clear up the topic about the difference between PrEP and PEP, and I have some learning objectives for you all today, which I hope that by the end of this video you can successfully answer. So first I have which antiretroviral drug is currently FDA approved for PrEP, and then once we start a patient on PrEP, what are some monitoring parameters that we need to consider? On the other hand, what is the difference between NPEP and OPEP within a PEP situation? And then what is our drug or regimen treatment of choice? And how long is that duration of therapy for a PEP situation? So let's get started. So the first thing that I like to think of is that PrEP and PREVENT kind of start with the same letters. And basically PrEP is going to be taken by an HIV negative individual that's hoping to prevent infection from HIV. In this case, PrEP stands for pre-exposure prophylaxis, and it's a total concept using a medication called Truvada that's taken once daily, and this is going to basically reduce the risk of viral exposure to HIV significantly. So Truvada exists as what we call a fixed dose combination pill, or an FDC. And essentially this medication was originally used, and it still is today, to treat HIV in adjunct with other medications as part of like a total regimen plan. But researchers found in 2012 that you can also take it by itself once daily, and that would prevent an infection from an HIV positive partner. So Truvada consists of two medications. The first one is emtricitabine, and this is dosed at 200 milligrams. And it also consists of tenofovir. This is dosed at 300 milligrams. It exists in its original salt form, tenofovir disoproxyl fumarate, which I abbreviated as DF. And I just want to go off on a little tangent here real quick, and that there's a new medication called Descovy, which also contains emtricitabine and tenofovir, but it contains a new form of tenofovir. This is called tenofovir alafenamide. There's some physiological differences as far as drug absorption excretion that I don't want to talk about in this video, but it's important to understand that Descovy is not FDA approved for PrEP or for HIV prevention. In other words, you should never have a patient coming into your pharmacy on just Descovy. That's a big red flag, okay? So as of right now, Descovy is only used in adjunct with other medications to treat HIV, and a PrEP patient is only able to take Truvada for now. So now that we have this concept of Truvada on board, who are some good candidates that can take this medication? We need to make sure that they are an HIV negative patient. We know that men who have sex with men, there's a high prevalence of HIV, so that's a good candidate for PrEP. Furthermore, we have this concept of the serodiscordant couple, and that one patient is HIV negative and the other is HIV positive. If the HIV negative patient takes their Truvada every day and the HIV positive patient takes their HIV regimen or their antiretroviral therapy, we can significantly reduce that risk of viral transmission. As my favorite movie quotes, it is a virus and it doesn't discriminate, so this would be a perfect medication for a female patient that is sexually active. And then lastly, we have to remember that HIV is a bloodborne pathogen. It's not just transmitted through sexual fluids. So we can also use it for patients that are injected drug users, substance abusers, things like that. Okay, so we found the ideal candidate that wants to use Truvada for HIV prevention. Now, what are some things that we need to consider before we start a patient on Truvada? It kind of goes without saying the patient needs to be HIV negative, so we need to have documented HIV negative status, and that needs to be done with an antibody antigen test and then another form of confirmatory testing. One of the medications within Truvada, specifically the tenofovir, can also be used to treat hepatitis B. So it's important that we have proof of immunity or vaccine status from Hep B, because in the case that this PrEP patient decides they no longer want to take Truvada, well, this could exacerbate their Hep B significantly. Furthermore, this drug is excreted renally, so we need to make sure that their creatinine clearance and that their hepatic function is at baseline and that remains sustainable level throughout treatment. There is a creatinine clearance cutoff for this drug, and that's 60 milliliters per minute. Next, if this is a female patient, we need to know their pregnancy plans or what their intentions are for pregnancy. That's something that we need to consider in regards to the fetus and in regards to breastfeeding in the long run. Okay, so we have a patient, they've started their Truvada. What are some monitoring parameters that we need to consider every time they come in for their follow-up? So according to the CDC and the FDA, if a patient is on Truvada for HIV prevention, then they need to be tested for HIV at least every 3 months during their course of therapy. While we know that Truvada does have a very strong resistance barrier as far as protecting against HIV, we can't guarantee that the patient's taking it every day. And in the case that the patient does become positive, then this could risk them having drug resistance. We need to make sure that we get a full treatment on board. So it's important that we test every 3 months and that we don't dispense more than a 90-day supply. Next, like I said, it was a highly excreted drug through the kidneys, so we need to make sure that we're monitoring renal function and then hepatic function as well. As far as the creatinine clearance goes, making sure that it's above 60 milliliters per minute. And then the first liver enzymes that are going to become elevated with prolonged Truvada use are usually your ALT and AST. Furthermore, if this is a female patient, have their pregnancy plans changed? Are they now pregnant at their follow-up? That's just something that we need to always bring up at every 3-month mark. And then kind of like I reiterated in the beginning, PrEP is an overall concept, it's not just Truvada, so we want to make sure that we're going over safer sex methods, that we're providing access to clean needles or syringes if they are injected drug users, just making sure that they have all their bases covered, because Truvada is not an end-all be-all 100% prevention method. With that being said, I want to go on to post-exposure prophylaxis next. So compared to pre-exposure prophylaxis, which is preventing before we have an exposure, then post-exposure is the latter. And I kind of compare it to the concept of the emergency contraceptive, Plan B. If a patient had unprotected sex, they have this 72-hour window that they can take Plan B and prevent pregnancy. Well, this is kind of the same concept for HIV with post-exposure, and that if a patient was exposed to HIV, the patient has a 72-hour window that they can take an HIV regimen and prevent that risk for HIV infection. So as I discussed in the learning objectives, there's 2 types of post-exposure prophylaxis, OPEP and NPEP. I'll talk about OPEP first, which stands for occupational post-exposure prophylaxis. And thinking of a job that's commonly around blood and bodily fluids, I always think of the healthcare workers, and the most likely risk for transmission is going to be through a needle stick, though we have to remember that viruses can enter by any means of a mucosal membrane using any blood or bodily fluid. It's important that we think holistically when treating an OPEP patient, and that the likelihood of them being exposed to other viruses or infectious diseases is possible. Remember, this is an antiretroviral and it's only preventing against HIV. So making sure to treat that patient holistically. Did they potentially get exposed to Hep B, Hep C, any other bloodborne pathogen? Moving on to the ideal regimen of choice, this is the CDC guidelines recommendations. The first drug that we're going to use is Truvada. It's taken every day, but different in that PrEP is only Truvada and PEP is going to have Truvada and another medication, typically from the integrase strand transfer class. These drugs usually end in Gravir, so the first drug that we would use in combination with Truvada is probably Epidemic, and the generic is dolutegravir, which is dosed at 50 milligrams every day with the Truvada. Otherwise, our other option from the integrase strand transfer class is Icentris. The generic is raltegravir, and this is dosed at 400 milligrams twice a day. This is a huge counseling point, in that if the patient takes their Tivicay and their Truvada every day, otherwise if they take their Truvada and their Icentris in the morning, they need to make sure that they have that second dose of Icentris in the evening. So it's important that you also as a healthcare provider are dispensing double quantity of the Icentris. In the case that we can't use Truvada and Tivicay, we have an alternate regimen that I'm going to discuss pretty quickly. And that is considered a single tablet regimen. The first 3 letters of the drug are STR, so that's just easy to remember. and that they only have to take one pill, and this is all the medications combined in one. The drug Stribilg, and it consists of Truvada, another integrase inhibitor called elvitegravir, and then a pharmacokinetic booster called cobicistat. This will help decrease drug metabolism and increase the body's drug levels. And I'll abbreviate that as COBI. This medication needs to be taken with food, and it is contraindicated for use with pregnancy. So now that we've covered an occupational post-exposure prophylaxis plan, let's move on to non-occupational. If occupational was in the work field, then thinking of non-occupational being anywhere else that HIV could have been obtained from. Obviously, we know that sexual fluids have a high risk for transmitting the virus, so the first thing that comes to my mind is a sexual assault victim. Next would be maybe a condom break with a partner that has a known HIV status, or with a partner that they didn't know the HIV status of. And then remember that it is a bloodborne pathogen and it can enter by means of any mucosal membrane, so injected drug users or substance abusers would be good candidates for post-exposure as well. Moving on to the regimen, it's pretty easy to recognize. So the first drug that we're going to use in a total combination regimen is going to be Truvada, and that's taken every day. And then the second drug is going to be Tivicay or Icentris. Remember that Icentris is 400 milligrams twice a day, and that Tivicay is the 50 milligrams every day. And this needs to be taken for a total of 28 days. Now what differs here is that in PEP's alternate regimen has a higher barrier to resistance compared to the occupational exposure's alternate regimen. And that's because studies have found that the likelihood of a healthcare worker obtaining HIV from a needle stick is almost slim to none, but it's a good treatment choice just to go ahead and use just in case the patient had a high viral load, they weren't on antiretroviral therapy, etc. So the first we'll use is Truvada. But instead of a drug from the integrase strand transfer inhibitor class, we're going to use a drug from the protease inhibitor class. And just something to know that these drugs usually end in navir. So the drug we're going to use is Prescovix. It's dosed at 800 milligrams in adjunct to cobicistat, which is going to help boost the drug levels. This combination needs to be taken with food, and it is contraindicated for pregnancy. As always, for 28 days. And then last but not least, an interesting concept that I've seen being practiced clinically today is something called PEP to PrEP, in which a patient that comes in for a PEP regimen or for PEP treatment is automatically added a refill of Truvada, and that they continue taking that after they finish the combination therapy, whether it be with Truvada or Tivicay, Truvada and Prescovix, then they can at least significantly reduce their risk for receiving the virus again in the future. And this kind of helps with patient compliance, knowing that they are protected beyond just this 28-day window. Now, last thing that I want to discuss is the counseling points as far as post-exposure goes. We need to make sure that the patient is adherent to their medications, making sure that you're running through your drug interactions, and just after that 28-day window, having them come back to get tested. Per the FDA or the CDC guidelines, the patient needs to get tested for HIV again at 1 month, at 3 months, and at 6 months. Especially if the patient is using that PEP to PrEP transition, then what is the case that the patient became HIV positive and they're just taking Truvada, which we know could cause drug resistance by itself. So obviously the likelihood of the high barrier drug not being able to catch that virus is slim, but there's no guarantee. It's not a 100% cure or 100% prevention. So that concludes the difference between PrEP and PEP. If you have any questions, please feel free to comment down below. I'll definitely reply as soon as possible. And then moving forward, I do want to kind of get more into these antiretroviral therapies. I'm looking at the new drugs that are coming out. Since they're coming onto our shelves every day, we have new patients that are switching to them, and it's important to be able to recognize those. Thank you guys so much for watching. I hope you'll have a good one.